I'm Dr. Samar Khalil, dermatologist practicing in Dubai and in Lebanon.
And I'm Dr. Loy Salah, a dermatology consultant from Saudi Arabia.
I'm Dr. Amin Sharobim, dermatology consultant from Egypt.
And
Welcome to
Eucerin
Eucerin
Skin Talks. It's the holy month of Ramadan, a month of reflection, discipline, and dedication. However, long fasting hours and disrupted sleep can affect the skin. So, Dr. Amin, how does the month of Ramadan affect the skin?
So the month of Ramadan affects the skin in several ways. I can see that a lot of women, they don't care about putting their creams and their routine during the holy Ramadan month. And that's they have a lot of hyperpigmentation because they don't put their creams, their usual routine. So sometimes the hyperpigmentation increase during this holy month.
Dr.
Yeah.
Duay, are there any maybe other negative effects and maybe some positive effects as well?
Yeah, we'll start with the negative effect. One of the most common negative effects that people tend to overeat in Ramadan and eat more sweets and more. And with sweets, you can get more acne because of the high glycemic index. And with acne, you can develop pigmentation as well, post-inflammatory pigmentation. So dealing with acne is also a problem in Ramadan, and we have to deal with the problem first to treat the pigmentation in these cases.
Besides foods with a high glycemic index, also dairy products may be associated with a worsening in acne.
Exactly.
So which foods do you recommend to avoid and which foods do you recommend that patients go for during this holy month?
I recommend that we don't use a lot of dairy products. So the less dairy products.
So to avoid.
Yes, avoid dairy products. When you avoid dairy products, you have a greater chance to have less oily skin and there's less acne.
Exactly.
So
Because
I think
these foods might increase inflammation in the body as a whole and cause worsening of diseases, including
and
acne.
increase the activity of the sebaceous gland, like the gland, the oils in your face. It increases with the dairy products and the high glycemic index, like you said, Dr. Loai. So I think that we should take care about these food during the holy months of Ramadan.
But the thing is, if we do fasting in the right way, meaning intermittent fasting, and we fast and we break our fast with something with less carbs, more fibers, less processed, we might get actually improvement in the skin condition because of the less inflammation in the skin due to this diet. Because studies have shown that with intermittent fasting, it can have actually positive effect on the skin in general, and in acne, and even pigmentation.
Other diseases like psoriasis, pigmentation.
Oh, yes, exactly.
All right.
Psoriasis.
And when you're doing intermittent fasting, like Dr. Lai said, and then you're eating a lot of antioxidants, like a lot of vegetables, a lot of fruits, and a lot of food rich with antioxidant, that makes your skin better, even your pigmentation better.
True. So we're talking about pigmentation. What are the different types of pigmentation? Dr. Duay, you want to start?
Yes, we sometimes classify pigmentation according to the level, if it's superficial or deep or combined. And then according to this classification, we can determine how to treat this pigmentation. And there are other classifications according to the cause.
I like the classification according to the cause.
Yes.
So the two main causes of pigmentation we have, the melasma, calaf, which is in a lot of women, and the post-inflammatory hyperpigmentation, which occurs really with the acne, like you've said.
Or any type of inflammation.
Or any type of
eczema.
inflammation. But acne is usually
Common.
girls who pick up on their scars or pick up on their acne. They have a lot of hyperpigmentation because of the inflammation. So we have like the melasma and the post-inflammatory hyperpigmentation are these the two causes. And they have to be treated differently. And they have to be treated continuously.
And on time. Dr. Luay, how do you treat such cases?
Melasma, for example.
Let's start with melasma, and Dr. Amin, you'll do post-inflammatory hyperpigmentation.
Perfect. First thing is sunscreen. Actually, sunscreen is very important, and people don't actually know how important sunscreen is, not only against the sun, also against visible light. So I usually recommend patients, when you use sunscreen, they start to use tinted sunscreens when they go out. Because we want to protect against the visible light, especially the blue light that has shown in studies that it has a major effect in pigmentation, especially in patients with our skin type.
But we're
darker skin
talking
types.
mostly about the blue light emitted by the sun and
Exactly.
not the blue light emitted by
Emitted
our
by-
devices, because the energy is too low. So
Yes.
it would be too much to ask our patients to put their sunscreen even at
Yeah.
night
Yes,
if they're
exactly.
browsing their
Unless
phones.
you're sitting like next to a very large window
It's
during
true.
the day.
True.
Otherwise, you don't have to.
True.
Number two is peeling agents.
Mhm.
Then you have different peeling agents, different lightening agents. Some of them contain hydroquinone, some of them don't. That can have actually beneficial effect in melasma if used properly.
And you're talking about creams or also peeling in the clinic?
We have this and that.
Okay.
They can use cream at home, or they can do chemical peeling or cold peel in the
They can
clinic.
do both.
But the thing that people need to understand, that melasma is a chronic disease. So it's nothing like, there's no curative treatment for it. You can improve with treatment, and then with topical sunscreens, with the continuation of using maintenance treatment, you can get a good effect. But once you stop, the problem can recur.
I always tell my patients it takes one bad exposure, one visit to the beach
Yeah.
to cancel all the progress we've
Yeah, to
accomplished.
return to square zero.
Yeah,
Yeah.
even sometimes worse.
Yeah.